So, welcome to Omnia Health Insights, your one-stop resource in all the latest developments transforming the healthcare industry. In discussion today is the flu phenomenon, and in particular the flu season, in the landscape of the pandemic. We are joined today by Dr. Hamwi, Consultant Internal Medicine, and Dr. Menon, Head of Clinical Lab at Fakeeh University Hospital. Welcome.
Thank you.
Thank you for having us.
Thank you. So my first question is, how is the presence of COVID-19 changing the flu?
Yes, indeed. Actually, the COVID-19 pandemic had a large influence on the seasonal influenza pandemic that we usually experience on a yearly basis. As far as the spread of the virus, since both viruses, the COVID-19 and the influenza viruses, they have a similar mechanism of spreading. All the measures that we have taken to tackle the COVID-19 virus with social distancing, with mandatory masks and hand hygiene, at the same time had helped in preventing the spread of the influenza virus. So what we have seen last year, that the seasonal influenza infections were at a minimal rate, just because it did not spread as it does usually spread during the peak season.
Yes, that's quite true actually, because the virus, both the viruses are fairly similar in terms of spread. And the important thing is that masking brings down the ability of a human being to produce aerosols. Masks also prevent you from touching your nose, because most humans touch their nose every few minutes. You know, that's a behavior we have ingrained in ourselves. And that infected hand goes around touching others. So by ensuring that we are masking, doing hand hygiene repeatedly, not shaking hands, maintaining social distancing, all these factors have helped see the marked reduction in influenza viruses all over the world actually. Sure.
And do you believe that the pandemic resulted in a decrease in the cases of the flu and by and large disappearance of the flu? And if so, what do you think were the reasons?
So yeah, absolutely, it did, and exactly for the reasons that I have just mentioned, which is related to the precautions that we are taking to prevent the spread of the COVID-19. That has led to a significant reduction in the spread of the influenza virus, and actually that caused some studies and some analysis as to why these precautions had resulted in more reduction in influenza viruses than in the COVID-19 virus. The conclusion was that because the COVID-19 virus is more easily transmittable more than the influenza virus. So certainly the measures that we have taken had caused a significant reduction in the seasonal influenza. We have seen actually recent studies from South Africa. So basically, the southern hemisphere, they go through the season of influenza when we are enjoying our spring and summertime, because they have the reverse seasons over there. So currently they are towards the end of their influenza season, and there were many studies and research and information that say that they have experienced a very low numbers of influenza, and we expect that's going to be the same. However, I think it will be important not to underestimate influenza, because influenza will remain. Influenza circulates all year long. However, it peaks in certain months for various reasons. So I believe at any time if the communities starts reducing their guards as far as the masks and the social distancing and the hand hygiene, influenza has the capacity to start picking up again. So it's very important to keep that in mind.
Just as an added information to what Dr. Fadi said, there are national influenza monitoring programs run within countries, which is coordinated by the WHO. So there is a periodic sampling which occurs. Even in the UAE, we have multiple sampling centers. We collect at a periodic basis certain fixed number of samples, both in children and adults. These samples are then tested for influenza. If they are positive, these samples are then sent to the National Center for Typing and Culturing, and that data is then sent to WHO. What WHO does is it keeps a regional as well as, as Dr. Fadi said, a regional watch as well as a global watch, and then you get an idea of what are the strains circulating in the environment. And these strains are then used as guidance for vaccine manufacturers, so as to see that the right strain is available at the right time in the right part of the world. So it's a big mechanism. Similarly, we have now initiated programs for COVID virus, the viruses which cause COVID, and that program is also now very successful in identifying the strains, what is available, what is causing the disease where, and how it is spreading. So that's very interesting.
So just circling back to studies being carried out internationally as well, there was one which circled around 800,000 laboratory samples which were tested for influenza, with only about 1,500 which came up positive, which is 0.2%. So how can we compare this to our regional insights and what we have seen in the hospitals and what specialists have seen in terms of numbers and just that kind of input?
So the answer to that is the data which you just now talked about is pretty much the same picture has been seen globally as well as nationally. This year we have I was actually today morning talking to the people at the National Center, and they were saying that this year they have hardly seen any influenza strains as compared to previous. But just remember, this is the beginning of the season. So in the next 2 months, usually September, October, November, this is the time when it starts picking up, and then it again starts fading off around February or March. So there are two things which can possibly happen with this. First and foremost is, of course, this year we may get away with a low level of infection, and many people may become slightly, may not really get vaccinated or, stuff like that. But then next year, there are two dangers. One, you will have a population which has not been exposed to the virus. And number two, there may be a new strain which may arise, which can then cause another pandemic. So we will have to be careful and, take our vaccines, etc., so that, we can ensure that another pandemic doesn't happen.
And just touching upon the flu season again, and in the UAE, which kind of months does it particularly occur? And I know we just mentioned September and October, November, the winter months essentially over here. But what are the factors which contribute to it? And does the school season kind of correlate with it? Does it kind of add to flu cases rising?
Yes. So basically, the flu season starts with the beginning of the fall, and it goes on for the fall and the winter time. So the main reason for it is the weather change, which happens between the summer and the fall time. It happens that the beginning of the year is also around the same period of time, the beginning of the school year, where going through schools and crowding and we know that viruses, especially influenza virus, is very transmissible between kids. So these are mainly the factors. Again, it's important to mention again that the influenza circulates the whole year. However, it peaks during the season, which is usually fall and winter. Here in the UAE, December, January, February are the highest peak for the influenza. However, we see oftentimes that the season can extend until the month of May.
Factors for influenza to rise in these months. So, are there particular factors which kind of make it, become more aggressive in the fall versus the other months?
Yes, most diseases have a seasonal variation. Okay, for example, gastrointestinal diseases, especially in the tropics, are more during the rainy season. Okay, similarly, respiratory illnesses for some, for a number of factors, are more seen during the winter months. Now, the most important factor probably is that we all stay indoors. We produce aerosols which are easily transmissible, and there is a greater incidence of cross infection. So then of course there is, as you rightly pointed out, the increased number of children getting into school immediately after holidays, playing with each other, exchanging their bacterial and viral genetic information, which is very vital actually. It is important for humanity to grow their immune systems. But with vaccines, we are able to now modulate that, to see that the disease is not so severe, see that the fatality and morbidity associated with illnesses are much lesser. So I think these are the most important factors which probably determine how diseases change season to season. And of course, there is human behavior. Now you can see the effect of human behavior of masking and hand hygiene and social distancing on influenza precipitated by the COVID virus. So it's always a mix.
And since the onset of COVID-19, the symptoms that COVID-19 sometimes has parallels with influenza. So what kind of tests are used nowadays to differentiate between the both? A lot of people do panic when they have the flu now and they think they might have COVID or symptoms of COVID. So what is the process like at the hospital to differentiate between the cases?
So in a hospital, testing is the only way you can determine the difference between viruses. So the gold standard for testing for COVID has always been real-time PCR. Okay, it is also an acronym for reverse transcriptase PCR, because reverse transcriptase PCR identifies RNA viruses, and both these viruses are RNA viruses, in both the influenza as well as the COVID virus. Now, as far as influenza is concerned, we rely a lot on antigen testing. So we, immediately we take a swab in the OPD itself. We are able to determine whether the person has an influenza, influenza A, influenza B, etc., etc. However, for COVID, we are still, trusting the RT-PCR, which is the gold standard. So probably any person who comes with a flu-like symptom will be asked by the physician to undergo both the tests. What do you say, Dr. Fadi?
Absolutely, I totally agree. I think the symptoms are very, very similar. We cannot differentiate based on symptoms. Last year, since we were in the pandemic of COVID with very minimal cases of influenza, so we were putting more emphasis on checking for COVID. And I think I have to admit that we kind of ignored the seasonal influenza last year. So we were doing less and less testing because our main goal was to identify people who had COVID, who are positive or not. For differentiation, we have to do the testing. One of the testing Dr. Menon had explained, doing the rapid antigen for influenza, in addition to also doing the PCR testing, which can differentiate between identify influenza in addition to the ability to identify the COVID-19.
So just to add a little bit more to what Dr. Fadi explained, as I previously remarked, both these viruses are RNA viruses. Okay, but interestingly, the membrane which covers the virus has different protein structures. So the COVID has got something called an ACE antigen, which makes a big impact on the body because it binds to the ACE receptors on the cells. On the other hand, the influenza virus has got two protein molecules. One is called H1, which is hemagglutinin. It causes RBCs to bind together. And another one called N antigen or neuraminidase. Now, scientists use this H and N antigens to classify the influenza virus. So the initial influenza viruses were called H1N1. And recently, more and more strains are something called H3N2. So whenever the influenza virus changes from H1N1 or H3N2 or H2N5, so many of these viruses subtypes have been identified. The human immune system forgets or is unable to identify it. And that is when a new pandemic starts. So you can see clearly in COVID. What happens is you have different strains of COVID now floating around. You have the alpha strain, the delta strain from India, the African strain, and as each strain comes up, the body struggles to recognize the new strain. And so it is important that not only do we do the diagnosis, but also keep on identifying and monitoring strains across the world. And that will lead to an effective vaccine strategy. Am I right, Dr. Fadi?
Absolutely, 100%.
And just coming back to understanding how the influenza phenomenon has been, and has it been ever evolving in the biology of influenza? Has it changed? And what kind of factors have attributed to that? And just in this present moment, what can we expect since the cases are on the lower side? Will influenza be back with a more aggressive swing in the near future, or what can we expect?
Shall I take that question, Dr. Fadi? It's very interesting for me as a molecular.
I will leave it for you, Dr. Menon. You're the expert with that.
So what happens wherever human beings cohabit with other animals or fowl or birds, there will always be an exchange of viruses. And one of the most primordial theories of evolution was given by Darwin. So Darwin said that organisms continue to evolve. So this is what happens when two organisms of two different types meet together in a body or in an environment. They exchange genetic information, and this genetic information usually leads. I'm putting it very simplistically, so please bear with me on this. So these genetic exchanges result in formation of new organisms or organisms which have slightly different properties, which then the human immune system can no longer recognize. And that gives rise to the next series of infections which may or may not result in a pandemic. So this is going to be the nature of things. It has always been the nature of things and is going to be the nature of things in the future. So yes, there are two influences which determine the evolution or emergence of new strains. First and foremost is called breakthroughs. So when an entire population has been exposed to a particular virus, they get immunized to that, they develop immunity to that virus. Or suppose they have been vaccinated, they get immunity, the vaccine produces immunity against that particular strain. But after some time, what happens is when a new strain emerges, again, it has got a free field, so it again goes around attacking people. So what WHO recommends and what we started doing for influenza is keep monitoring these strains globally, use the right mixtures to make the vaccine so that by the time it can become a pandemic, you already got a vaccine ready to handle the pandemic. So you see that extensively happening in influenza. I'm sure that will happen in COVID too in a few years' time. But right now, as far as your question is concerned, yes, we should continue monitoring and we should make vaccines, or we are making vaccines, which will ensure that an upcoming pandemic is controlled. I hope that answers your question.
It definitely does. Thank you so much. So just on a last note, in a nutshell, your experiences with patients in terms of COVID, the flu season, influenza on a whole, what would be, the kind of advice you would give to patients and even healthcare professionals in the region in terms of being more prepared and, practicing safe habits and, so just that even with the schools being open at the moment, everyone across the world can be in a better place and they can handle infection or, the possibility of transmission in the safest way possible.
Absolutely. I think the best advice and the main advice is to adhere to the proper precautions that nowadays everyone knows what to do, how to do it. Wearing the masks at all times, hand hygiene and social distancing. These are the best measures to prevent people from contracting COVID-19 and from contracting influenza. And I must add, there are so many other different of seasonal cold and flu viruses, rhinoviruses, that are similar also symptoms to influenza. And this is a big burden on people, on schools, on workplaces, and on families. And these also circulate at this time of the year. So by taking all these precautions, we are reducing the chances of being infected with any of these viruses.
There is an old Shakespearean saying, familiarity breeds contempt. My biggest worry is we will take COVID for granted. We will stop doing all the good things we have learned. You see it in the US. You have such an educated, well-developed, highly developed country with plenty of everything, but they have one of the highest death rates for COVID. They have groups of people who are anti-vaxxers. There are people who make it a political statement not to wear a mask. So it is very, very important that we continue to mask ourselves properly, not let the mask slip below your nose, which is very common. And more importantly, follow hand hygiene, follow social distancing, ensure that you're vaccinated, ensure that your family is vaccinated, ensure that the people who are prone to disease, diabetics, people who are immunosuppressed, they are vaccinated. And more importantly, as a lab person, I keep telling people that everybody's vaccine response can vary. So please check how good is your vaccine response. Do you have an antibody level which is protective? So these are some of the things which we have to reinforce over and over again till we can say that the pandemic is past us.